My name is Lawrence Babawo, a member of the Pandemic Preparedness Project and also a member of the Scientific and Technical Advisory Group for Emergencies that was appointed by President Julius Maada Bio on the 23rd of April 2020 to advise him on the COVID-19 interventions. We had a broad mandate, and the broad mandate was to provide real-time scientific advice and insights from research and state-of-the-art technological interventions that will go to informing what the activities will be like for the COVID-19. And then we also had a goal which was to advise on prevention and mitigation through the use of robust public health interventions that we are going to help to mitigate or that we are going to help to stop the spread of the infections. That is the COVID-19 infection. Now, what was our approach? One of the approaches we used was a weekly scheduled meeting. And in those meetings, we would analyze the data that has been presented from the various pillars, and then based on that, we can now inform or advise the president through the presidential task force. We talked about vaccination. There were a lot of conspiracy theories around vaccination, but we tried to advise government as to how to dispel some of those conspiracy theories. We did, for example, when we had people said, "Oh, people have come with medication to kill our people, to make people impotent and that kind of thing." So we suggested to government, we advised government on what needed to be done in those areas so that people understand that this was a disease and it needed ways and means of combating it. The last thing, we also look at sustainability. How would all these things be sustainable? In that regard, we looked at capacity building, where we emphasized that the personnel needed to be trained, the infrastructure needed to be improved upon, and the equipment or the facilities that were supposed to be used for the COVID were supposed to be available at all times. And then we also realizing the fact that every outbreak is anchored on research. We emphasize on research, and there were organizations during the COVID outbreak that were actually engaged in research, and some of the results of this research actually informed our advice, some of the pieces of advice that we gave to government. Being a member of the Pandemic Preparedness Project and also being a member of the Scientific Technical Advisory Group for Emergencies, we use some of those things that we found and we discovered in the Pandemic Preparedness Project. For example, at quarantine, and we did discuss those things at a very, very extensive level, and we advise government on those issues. Even lockdowns, how lockdowns were supposed to be done so that it doesn't affect the livelihood of people, etc., etc. We look at those things. Even the use of the local communities, the local leaders, was an issue that we discovered that we found out in the Pandemic Preparedness Project, which was used by state to inform government, to advise government. So those were some of the issues that we actually were engaged. I thank you for your attention, and I hope this makes some sense to you. Thank you.